Welcome to this educational video on antibiotics, the powerful medicines that have revolutionized modern healthcare. Antibiotics are drugs specifically designed to kill bacteria or stop their growth, helping our bodies fight off bacterial infections. Understanding how these medicines work is crucial for using them effectively and responsibly. Antibiotics are medicines that fight bacterial infections in our bodies. They work by either killing bacteria directly or preventing them from growing and multiplying. It's important to understand that antibiotics target bacteria only. They are completely ineffective against viruses, which cause infections like the common cold, flu, and most sore throats. This is why your doctor won't prescribe antibiotics for viral infections. Antibiotics work through two main mechanisms. First, bactericidal antibiotics directly kill bacteria by destroying their cell walls or disrupting critical internal processes that bacteria need to survive. Second, bacteriostatic antibiotics stop bacterial growth and reproduction, giving your immune system time to eliminate the weakened bacteria. Both types are effective, and doctors choose which type to prescribe based on the specific infection and patient needs. There are several major classes of antibiotics, each working in different ways. Penicillins destroy bacterial cell walls during growth and were among the first antibiotics discovered. Cephalosporins work similarly to penicillins, but are effective against a broader range of bacteria. Macrolides block bacterial protein synthesis, preventing bacteria from making the proteins they need to survive. Fluoroquinolones interfere with bacterial DNA replication, stopping bacteria from reproducing. Antibiotics are classified by their spectrum of activity. Narrow-spectrum antibiotics target specific types of bacteria with precision, making them ideal when doctors know exactly which bacteria is causing the infection. Broad-spectrum antibiotics are effective against many different types of bacteria, making them useful when the exact bacterial cause is unknown or when treating severe infections. Your doctor will choose the most appropriate spectrum based on your specific condition. Antibiotic resistance is one of the biggest threats to global health today. It occurs when bacteria evolve and develop the ability to survive antibiotics, making infections harder or even impossible to treat. Resistance develops through three main causes: overuse and misuse of antibiotics, not completing the full treatment course prescribed by your doctor, and using antibiotics for viral infections where they have no effect. Each time antibiotics are used incorrectly, bacteria have another chance to develop resistance. Bacteria develop resistance through several sophisticated mechanisms. Through mutation, bacteria undergo genetic changes that make them immune to antibiotic effects. Through gene transfer, bacteria can actually share resistance genes with each other, spreading resistance rapidly. Some bacteria produce special enzymes that break down antibiotics before they can work. Others develop efflux pumps, which are like molecular pumps that push antibiotics out of bacterial cells before they can cause harm. These mechanisms make bacteria increasingly difficult to treat. Using antibiotics properly is essential for your health and for preventing resistance. Only use antibiotics with a doctor's prescription, never self-medicate. Always complete the full course of treatment, even if you start feeling better before finishing all the pills. Never share your antibiotics with others or use leftover antibiotics from previous prescriptions. Take your antibiotics at the prescribed times and doses consistently. Following these guidelines helps ensure the antibiotics work effectively and reduces the risk of resistance developing. Like all medicines, antibiotics can cause side effects. Common side effects include nausea and vomiting, diarrhea, and allergic reactions ranging from mild rashes to severe responses. Important precautions include avoiding alcohol while taking certain antibiotics, as it can interfere with their effectiveness. If you're pregnant or breastfeeding, always inform your doctor before taking antibiotics. Report any severe reactions to your healthcare provider immediately, especially difficulty breathing, severe rashes, or intense abdominal pain. Let's review the key points. First, Antibiotics fight bacterial infections only and are completely ineffective against viruses. Second, antibiotic resistance develops when these medicines are misused or overused, creating bacteria that are harder to kill. Third, always complete the full course of antibiotics as prescribed by your doctor, even when you feel better. Finally, proper use of antibiotics preserves their effectiveness for future generations, ensuring these life-saving medicines remain available when we truly need them. Thank you for watching.
If you like this video, hit that like button and don't forget to subscribe. Visit codelucky.com for more such useful content.